All right, Nick, thanks. The opioid epidemic has shown how dangerous narcotics can be, even when they're prescribed properly.
So even after hundreds of thousands of overdose deaths and many people developing a substance abuse problem, it is still difficult sometimes to find non-medical treatment for chronic pain.
Yeah, Dr. Gautam Desai, professor and chair of primary care at Kansas City University, is here to discuss some other treatments that may help. Good morning, Dr. Desai.
Good morning, Abby and Pat.
So, doctors are less likely to prescribe narcotics or opioids now. So is it okay, though, to take them in small amounts for a small amount of time?
Yeah, so if you have, an acute injury, then they're safe to take if you can just take them for, a few days and then try the other things that we recommend also, just things like the ice and elevating, things like that. But for a short amount of time, they're okay.
And realistically, Dr. Desai, are there other medications that people could take for relief from the pain from, serious stuff like surgery or a dental procedure without, prescribing the heavy pills?
Yeah, a lot of times taking over-the-counter medications such as ibuprofen can help because they're anti-inflammatory, so they help that inflammation there. The opioids and other medications work kind of by masking the pain on the brain receptors, but if you can get that inflammation down, one thing that I found helpful is just taking it as scheduled. If you don't have any, stomach problems, if you can take it every 8 hours and try and stay ahead of the pain, that's more helpful than waiting until it's saying, oh, it's starting to hurt again. Let me take my next dose. And then just combining that, with the ice and rest will oftentimes be more effective than not.
And do things like acupuncture or physical therapy actually work? And how long does it take to get the results from procedures like that?
Yeah, great question. I mean, people that are in pain will be looking online at all different things to see what can help them because they're still suffering. So acupuncture has been shown to work for several things like knee osteoarthritis. If you have pain after a dental procedure, it can be helpful for that. And sometimes the effects are, immediate. Now, if you've had chronic pain and had back pain for 20 years, it may take a few visits. So I'll give it at least 3 visits and see if acupuncture can help you for that. And physical therapy can help also. And what that does, if you have a joint that hurts, like your knee, if you make those muscles around it stronger, then you can help make that joint more stable. So even for the back, for back pain, making your core muscles stronger, they can take up some of the slack and help prevent, further injury to your back. And that's more of a, a longer term approach, but probably more helpful.
That is good advice. I have heard that, if you have lower back pain, a good strengthen your core.
Yeah,
that's one good approach.
I'm a patient of both of physical therapy and acupuncture now.
I thought yeah.
And both, I agree, can be extremely effective.
Yeah, I know. You mentioned the chronic, pain, Dr. Desai. So what if sometimes pain is so chronic it leads to like emotional or mental health issues?
Yeah, I know a lot of people were stressed last night, but the Jayhawks did come back. But all joking aside, I think the one thing that is key to helping people with chronic pain is fixing that sleep. So people that are in pain can't sleep. If you're not sleeping well, you're going to have more pain. So it's just this vicious cycle that probably should be one of the first things to address. So working with your provider to try and, think of non-pharmaceutical ways to help you get some sleep is probably the best initial approach. And then also just working on your mind. There's so many things to worry about, so if you have pain on top of everything else that's going on in the world, that's going to make it much harder. So things like meditation or behavioral therapy or fixing the mood can help as well.
I mean, excellent advice. So much of it can be fixed by your mental state. So, all right, Dr. Desai, thank you.
Hey, my pleasure. You guys have a great week.
Thanks, you too.